Hey, are you ready for a little education for Breast Cancer Awareness Month? Well, you've come to the right place. I'm Carrie Stricker. I'm an oncology nurse practitioner of over 20 years, and much of that time I have specialized in breast cancer. So you got a few minutes? I'm going to teach you a little bit about why you should care during Breast Cancer Awareness Month about EDCs, or endocrine disrupting chemicals. So to kick us off here, I'm going to tell you a little bit about the endocrine system in general and why you should care about it when it comes to Breast Cancer Awareness Month. Well, let's share this slideshow and get going. So the endocrine system just means the hormonal system. It's extremely complex. There are many hormones and many hormonal glands. You've probably heard of the pituitary, the thyroid, the thymus, maybe adrenal, your ovaries, and then it's the testicles that produce hormones. And what's amazing about hormones is they're fine-tuned and they're very sensitive to being put off by outside influences. And they naturally operate at low doses. So anything that interferes with that production or signaling or how they interact with cells in the body can be really significant in terms of health effects. And the World Health Organization, all the way back almost a decade ago, said that endocrine disrupting chemicals are becoming a global health threat that needs to be addressed. And that's because not only are there so many hormones in the human body, and so many thousands and hundreds to thousands of receptors for those hormones throughout the body and signaling pathways, but there are also tons of endocrine disrupting chemicals. There's tens of thousands of chemicals that have been produced since World War II time. And you may not know that there's less than 50 that are banned in the US in our personal care products. And many of these are endocrine disrupting chemicals, which simply means chemicals that interfere with our body's many hormonal functions, either by one, acting like or mimicking a hormone, two, blocking the effect of that hormone, or three, in some other way interfering with that. So I'm going to talk a little bit about that and why we're talking about it in Breast Cancer Awareness Month. So let's talk about acting like a hormone. So when we think about breast cancer, what do you think about most? What hormone? Think about it. What is it? Well, we think about estrogen most commonly. Estrogen, we know, causes breast tissue cells or mammary glands, mammary tissues to grow. There's lots of other effects, just while we're at it. It can help prevent skin aging. It can increase liver proteins. That can influence cholesterol levels. It helps protect the heart. So many influences. Progesterone may have similar influences, including on mood. And breast cells are targets of estrogen and progesterone. All right, let's bring this back to why we care. Well, when estrogen or progesterone binds with an estrogen receptor, which there are on many cells throughout the body, including the breast, it tells those cells to keep dividing. And this can ultimately contribute to the production of breast cancer, because when you cause a cell to grow more, it can mutate into a cancer cell through genetic mutations, become uncontrolled growth, and thus become cancer. So when we talk about endocrine disrupting chemicals, if you think about a chemical that mimics, one thing we can think about is hair products, skin products, masks that have placental extract in them. And I particularly highlight this because I've become really aware in the last couple of years about disparities that in health equity issues, and more products for BIPOC women and African American women have placental extract in them, which acts like an estrogen. And so studies have even shown that African American women who used placental extract-based hair products, when they were young girls, they had early breast budding, so premature breast budding. So that's clear indication of a estrogenic effect. So even if you're not using products with placental extracts, what's much more common in products that can influence all these various glands. And by the way, it's not only estrogen that matters in breast cancer. So the pancreas produces things like insulin growth factor, insulin-like growth factor that has been implicated in breast cancer being caused and made worse as well. And this is also why women who are obese have a higher increased risk of breast cancer, because we think it's because of insulin-like growth factor. Anyway, back to endocrine disrupting chemicals. So if we look at, so we already talked about mimicking a hormone. What about interfering with hormonal signaling? Why does that matter? And what should we be concerned about? Well, I commonly talk about the 3 Ps: parabens, phthalates, and PFAS, or perfluoroalkylating substances or chemicals. And bisphenols, which you most commonly have heard of BPA, and plastic products, or in lined cans, but there are other cousins of those. Those are problems for endocrine disrupting chemicals as well that interfere with hormonal signaling. But let's take one, phthalates. So this is a funky scientific diagram, but it's actually kind of cool. So this is a cell membrane. This, if you remember your biology, is the cell nucleus. And inside the cell nucleus in the cell cytoplasm are various progesterone receptors that, if progesterone binds to them, causes cell growth and cell division. Well, phthalates, and really key point, don't forget this, look for parfum or fragrance in your products, if nothing else, because the most common ingredient in parfum or fragrance, which they don't have to disclose because of a loophole, is DEHP, or diethylhexyl phthalate. And when that gets into the cell, this word, increased proliferation, means it interferes with the progesterone signaling by causing more progesterone receptors to grow. And thus, it's like getting a higher dose of progesterone. All right, I went deep today. Net, what you need to remember are endocrine disrupting chemicals matter. And they are found in all kinds of products. And what can you do to avoid these and reduce your risk of breast cancer, of obesity, of chronic health conditions, but especially this month, reducing your risk of developing breast cancer, or if you've been diagnosed with cancer, having progression of your cancer? Well, avoid these kinds of chemicals. And to do so, what I would like to share with you is one, beyond you're in this group learning about Beauty Counter, which I'll talk more about in a minute. But if you do nothing else, please go to EWG, Environmental Working Group, and I'm going to pop it up on the screen for you here so that you can see it again. Go to EWG.org, Skin Deep, and you can put your products in here. And so there's the website. So you can type any product in here, or download EWG's Healthy Living app on your smartphone. And that's how you can avoid these chemicals in your personal care products. Or if you're in this group, you've heard a lot already about Beauty Counter and its Never list, which now includes over 1,800 ingredients, including endocrine disrupting chemicals, all of them. And not only are they banned, but we have a 3-step testing process. So to ensure that not only in the ingredients that we source, but also in the products we make, and then when we test the products one final time before they go out to market, that they don't have any of these ingredients. So get your mammogram if you're due. If you have a family history of breast cancer, talk to your doctor or nurse practitioner or other healthcare provider about getting tested for breast cancer risk. Exercise, eat lots of fruits and vegetables and grains, and reduce your red meat. And also avoid plastics in your food containers wherever you can, and get organic fruits and vegetables whenever you can. Those are some other ways. If you need to prioritize where you spend your money on organic foods, check out the Dirty Dozen by EWG, that same group. So it's better to buy like things you have to peel, like an avocado or a banana, that aren't organic, than berries, for example, which you can't peel. So thanks for listening, and take care of yourself, your breast, and this Breast Cancer Awareness Month. And I hope you learned a lot today.